Welcome to our Insight series on organizational well-being. Our question for this week is, how can you get senior managers to value your wellness program? Number 39. Last week we looked at the 9 reasons why senior managers oftentimes don't value wellness programs. And we're going to go over each of those reasons. I'm going to give you then a possible response or strategy to reverse that particular belief. And I'm going to try to give you 3 things about implementing the particular strategy for each of the reasons. So let's begin with our first reason, which is the program is not seen by management as strategically important. It may be tactically important. It may be something that they would like to have, but not feel that it has real relevance to the organization or to the enterprise. The response or strategy that you might use is called a human capital approach. It's where you talk about your workforce as human capital, and you're investing in that human capital to make it more economically efficient for your overall organization and to improve the health and well-being of the people that are part of that workforce. And you want to use economics to help you make that strong human capital case. Now, the 3 things that you might do to implement this particular strategy is you first of all determine the total cost of worker health. And that means that you know how to put the cost of your health plan alongside of your workers or your sick leave, alongside of your workers' comp cost, alongside of your disability insurance, short-term and long-term, and alongside of what's called presenteeism, which is productivity loss that occurs when someone stays at work and has an underlying health problem. You can then compare that total cost of worker health, which, by the way, is about $40,000 per employee per year, which is a huge cost to virtually all organizations. But since they don't put all those costs together, they oftentimes just look at their health plan cost and then not look at the other 4 costs that we just mentioned. So you want to compare that total cost of worker health to your after-tax profitability if you're in the private sector and the profit-making sector, or if you are in the public sector or governmental sector, you want to compare it to your net revenue. That's what you've got left over when you pay all your bills at the end of the year. And then you want to make the next 5-year projections. And a lot of what we do in the WellCert program is actually show you how to do this. So those are 3 different ways in which you can use this human capital approach when the economics of human capital to make a stronger case for the strategic value of wellness. The next reason we're going to look at is the senior managers may never have seen a successful program. They may have come from an organization that had a pretty poor wellness program, so they may not value the wellness activities. The strategy you might respond back with is to showcase effective local programs. And that means that the things you need to do are, first of all, find the local program with 80% plus participation year after year, and then outline their program components for your senior managers, and then project that program effect onto your own organization, particularly if they've done any kind of economic or evaluation of their program. The next area of reason is that senior managers don't know the economics of worker health. And you need to present your own organization's business case, which means you first of all have to determine the total cost of worker health. You then make a 5-year projection based on what experience you've had in the last 5 years, and then compare that with your after-tax profitability and or net revenue projections. So that immediately gives you a much clearer business case. Another part to this, the third part, is you can estimate the reverse ROI. And if you're using a 1-to-3 ratio called what's called a cost-benefit ratio. It's $1 of cost to $3 of benefit per year. That's pretty typical for most garden variety wellness programs. And you then want to estimate what that effect is based on the proposed cost of your program. And that helps you complete the business case for your senior managers. The next reason is that wellness is not required. Therefore, many managers just say, well, it's not required, so we don't need to do it. And I think a response or strategy that you might have is, can we afford not to do it? Particularly when we look at the cost involved of worker health. So that 3 steps that you might do to implement this include identify your health challenges. And we have COVID to look back on. We have the possibility of another pandemic coming down the road. We have aging in our workforce, which leads to much higher health costs. And we have various kinds of mental health needs, anxiety needs in our population, so in working population. So you're basically helping to identify those specific things, and then you're looking at the total cost of worker health to give economic value to those and those issues, knowing that most of those health challenges are going to increase what your current spend rate ratio is. And then you want to make some 5-year projections with a comparison to your after-tax profitability or net revenue projections. The next area of reason is that the success requires specific skills. And unfortunately, our HR staff usually does not have the kind of skills that allow you to put a wellness program together. And the response or strategy you might use to deal with this issue is to say our staff can get training and certification to actually put good programs together. And that's available. And WellCert is a program that's been designed to fill those key skills in to be able to have successful programs. And the 3 things you might think about in implementing this strategy are, first of all, the need for analytic skills, and particularly the economic skills, the design skills, and the program operating skills. All of those are, in a sense, unique to wellness programs. And secondly, it's more than just event planning, which a lot of managers kind of consider that that's all it is. And it has to involve ways of building strategies like the AMSO construct, which you can do a search and find our videos on AMSO. So that's a strategy that's designed to bring about much more long-term behavior change in wellness. And those long-term behavior change skills can be gained by doing the WellCert program and the certification that's involved. The next area of reason is that employers don't know how to incent employees. And in working with more than 1,000 employers over 45 years of professional and career, I can tell you that few employers know how to incent employees. And the best method that I found is using a health plan premium waiver. And that means that you add a $50, $100, $150 premium contribution onto each individual employee's health plan coverage, and then you waive that if they're participating in wellness. And to be able to get that strategy implemented, it essentially means you have to decide what that monthly premium contribution is, and then what are the criteria that allow it to be waived. Those again are covered in our WellCert training. Those who don't do wellness pay part of the program's cost, which is actually pretty reasonable, because if you're not doing wellness, you naturally are becoming higher risk and using much more in the way of health plan resources and sick leave and so on. So there's a good deal of reasonableness in this premium contribution waiver concept. This will produce 80% plus participation each year. So that's the best method that I've run across and used over my professional career. The next area is the reason that senior managers oftentimes don't value wellness is because they've had experience with free wellness programs that don't work well. And unfortunately, I've done quite a bit of analysis of vendors and health plans and their wellness programs. I can tell you that about a quarter of them are really effective. The rest of them are not very effective and are not designed well enough to produce results that you want. And you need the strategy that you need to come against this particular idea or reason with is you need to know how to be a wise wellness program buyer. And that's something that you can do in the following steps. You have to know what produces long-term behavior change. You have to know how to assess a program's utility and value. And you have to be able to know how to get the most from the free programs that are offered. So those are some of the elements that you would need to do in order to have that strategy. And again, the WellCert program covers this information. The next area is early over-promising by advocates of wellness and employee wellness poisoned the well. So that means that a lot of managers said, oh, they promise too much and can't deliver. And unfortunately, a lot of the early advocates and early proponents promised more than they could deliver, and that then poisons the well. The response or strategy you might use is to be conservative and realistic and to design and execute your programs well. And that it can be done by being conservative in forecasting. You can design the program carefully, and that's the level 1 Certified Wellness Program Coordinator training does that design skill activity. And then you can implement it well and execute it well. So those are the elements that help you know how to be a wise wellness program buyer when you are not, you're in that position of buying a wellness program for a particular employer. So those are, you want to be realistic and design and execute well. And finally, the academic ROI standards that were used to assess the effectiveness of wellness programs were unreasonable. They were unreasonable because they required much too much sophistication in analytic approach, and the existence of few well-designed programs left us feeling like the ROI was questionable. And the response that you might want to make back to that is to use well-designed evaluation of your program and what's called trend line analysis. So what you want to do is to look at things over time in what's called in the evaluation sphere time series design evaluation. And the things you can do are, first of all, select some key metrics that are important. You can cover all the major issues your senior managers want to know about. And you can then use that time series approach and trend line analysis to make a much more clear identification of what the economic and health improvement effects of your program are all about. So in summary, most senior managers don't think employee wellness programs are that important to their organizations. In order to change that belief, you must find out which reasons of these 9 reasons apply to your senior management group and then use the correct counter strategy to change their position. This is critical for the future of your employee wellness program. Now, for more information on this topic, try putting the following search strings into your web browser. First one is strategic approach to employee wellness programming. The second one is what senior managers need to know about employee wellness. The third option would be what makes wellness programs important. So next week we will address the question, how much funding should you request for your employee wellness program each year? For more information on this topic, please search on the web for the WellCert program.